Hey guys, happy Sunday guys. I'm super excited once again to have you guys joining us on the show. As usual, we have exciting topics lined up just for you. Remember, this is a place where we talk about all things motherhood, all things parenting, and we walk the journey with you as you raise your beautiful children, right? And the most important thing is we love it when you guys join in on the conversations with us. So do remember to, talk to us through our social media handles. That's Ebru TV Kenya. Let us know what you're going through. What stages are you with your children? Are you pregnant? Which month are you in? What are you going through? Reach out to us and let us know, because we love to get into conversation with you. But on the topic for today, we want to talk about oral hygiene. Don't change the channel yet, because truth be told is that the last time you visited your dentist was probably a long time ago. And oral hygiene, as we will learn today, is actually a very detrimental thing. Did you know that your oral hygiene can actually affect the weight of your child when you're pregnant? Did you also know that oral hygiene is one of the leading causes of absenteeism in some of the schools, especially in our rural areas? You guys need to stay tuned, because we have so much information. Our guest today will be educating us more and reminding us why we need to go visit that dentist, all right? So, karibu sana.
Thank you so much.
So glad to have you here on set, Benjamin.
Thank you.
So you're a pediatric dentist?
Yes.
You deal with kids?
Mainly. That's what I do.
So
yes.
You're that doctor who will have many sweets prepared for the children you're going to be seeing.
Most likely.
Most likely.
Yes,
Why did you choose becoming a dentist?
That was a decision I made way back in 2016.
Okay.
When I was 2006, sorry, when I was growing up, we didn't really know much about dentistry.
Okay.
So after finishing my fourth form, I had to make a choice.
Yeah.
And I needed something brief, something that wouldn't take me deep. At that point, I thought I'll just do the first degree and leave and go do other passions.
Okay.
But then as you come in and you learn more things, you get interested. And children sometimes fascinate us, and sometimes I say I like treating children because they're the only ones who will tell you the truth. An adult will come because they want you to attend to them. They might tell you they have a toothache when they don't. Child will say I have or I don't, and they'll be sincere.
Okay.
Yes, so that's how I ended up doing dentistry, and then I came back to school, and now I'm in my final year doing a master's in pediatric dentistry, which I hope to be finishing in the next 4 or 5 months.
Wow, all the best with that.
Thank you so much.
But I'm just thinking, pediatric dentistry, that means 10 million children, all different personalities. I think when I last visited the dentist, which was probably years ago, or rather the image that comes to my mind is us kids running around because they're running away from the doctor, the dentist. They don't want to say so it's a real struggle. Are you ready for that challenge?
You see, when you're training for masters in pediatric dentistry, you're not going to do it after. You are doing it. That's what you do. That's what I do every Monday to Friday, 8 to 5.
Yes.
I deal with children.
Oh wow. Okay.
Children, they are the most misunderstood people. All of us have fear and phobia. It's just how you introduce them, and we mainly do what we call behavior modification and behavior management. And when you manage to manage a child's behavior and they develop a positive attitude towards the dentist, then you feel happy and everything. And most of the time they have so many things to be done that you just have to modify that behavior and get them into that. Very few, like in Kenya right now, it's only about 20% that we go and do sedation and general anesthesia. Most of these children, you talk to them, tell them what they'll experience. Children are not small adults. Children are children. So you tell them in the language they'll best understand. And they carry along with you, and eventually you have them on board. And you see, when you have them on board, they'll actually remind their parents. They'll even tell their parents, remember, I have a dental appointment.
That's true.
And it even excites them that they'll even go tell their classmates, and you'll even have a child referred by another child to their dentist. So though now, at the moment, the pediatric dentists are so few, but generally, even at the basic degree, we still have good training for them to handle children. Only those who are slightly problematic do. the general dentist refer to the pediatric dentist. But generally, if you even go to a general dentist, he will generally be comfortable handling children. But if the children is a bit problematic, they will refer. They won't refer because they can't handle it. It's mainly the behavior bit, but the treatment, most of them can do.
Okay.
Yes.
So like the general pediatric would not probably have covered the behavior management that
they cover it, but not as exhaustive. You see, I'm in school all this time seeing children from Monday to Friday.
Yeah.
So you encounter them. But when you are doing many other things, then you don't really have the personal contact with the child.
Okay,
yes.
That's true.
And even in general practice, you'll realize most parents will only bring in their children on Saturday.
Yeah.
So still, again, you encounter with the children in general practice then becomes not as much as the pediatric dentist.
Okay,
yes.
All right. So let's just get into the conversation. Maybe you can tell us, or rather enlighten us on just a little bit about oral hygiene. Because when I hear oral hygiene, I just think brush my teeth, thrice a day, and I'm sure we really don't follow that. But most of the time we'll brush morning and evening at most, and that for me is oral hygiene for me. But from your end, what exactly is it?
Now, oral hygiene, I'll talk about it as a behavior, as a practice.
Yeah.
It is what you do with your mouth to keep disease, especially dental disease, away from it. Now, brushing is just a small part of it, because brushing, you can brush, but there's the brushing technique, which has to be put in place. Yeah. And every time you go to the dentist, sometimes they'll tell you you're brushing too much horizontal, and that's why you're feeling sensitivity, because you're not brushing the correct way. So the first thing is brushing. One way, I agree with you. You have to brush at least twice a day. That is what we say, minimum twice a day. In the morning, we insist after breakfast, not before breakfast, but at night is after supper. Okay. So that you brush as the last thing when you're going to sleep.
All right. All right, we want to take just a little break, Benjamin. We'll be right back, guys. Just check out our mom hacks as we continue on with our conversation right after this. Those were hacks right there. I know one of the biggest struggles that mothers go through is when their child is teething, when those little teeth are developing and the child is so uncomfortable. But right before we get into talking about how to manage teething, we just want to understand when pregnant. So Benjamin, maybe you can just educate us a little bit on our why do I keep saying oral health when we are pregnant? Because as we mentioned earlier, that it can actually affect your baby's weight.
Yes.
So maybe just tell us a little bit about this.
That the relationship is usually very simple.
Yeah.
When the lady is pregnant, she needs to eat well.
Okay.
So we insist that you have your dental checkups done, and anything that might go out of hand, your gums cleaned so that you don't have swelling of the gums when you're pregnant, any cavities filled. That way we ensure that you don't have pain when eating. Now you see, when you don't eat well, then it directly affects your baby. Okay. The second thing is even the contents of what you eat.
Yes.
Now when you don't have enough vitamins and enough minerals, you realize the baby, the teeth, the bones, that is mainly, they need calcium, a lot of calcium. So if you're not eating well, you don't get enough calcium. And if you don't get enough calcium, then it just moves to the baby, and therefore you'll have things like the tooth is not well formed because we didn't have enough of the nutrients. So mainly vitamins and the minerals are what we need, and we need the mother feeding properly. And it is usually underestimated, but the moment you have a toothache and you can't eat and you're pregnant, and it goes on for long, because at a certain stage in pregnancy, we can't do an X-ray maybe to see what the problem is. Now, if you can't do an X-ray, you can't find out what the problem is, and you can't sort out. So you'll only be sorting out what you can see. Although sometimes in late pregnancy, then it can be done. Although there is the myth again that a pregnant mother can't undergo dental treatment, they can actually undergo dental treatment. They should not avoid dental treatment. We just avoid X-rays at certain, especially the early stages of pregnancy. So it's mainly related, the birth weight of the child is usually mainly related to the feeding and the nutrition of the mother during pregnancy.
So it's because if I do have any oral issues, then I might not eat as I should, and therefore it affects my child's baby. Okay.
Yes, and children need a lot of nutrients. When bones is forming and teeth is forming, the two usually need a lot of nutrients.
Okay. Yes. All right. So what you're recommending is that actually when we are pregnant, one of the checks, aside from going to your gynecologist, should be visiting your dentist as well.
Yes, it should be visiting your dentist. And even some of these gynecologists these days, they refer the mothers to the dentist. The dentist has a look and gives his opinion. Because again, if you have active caries in your mouth, active cavities, when you give birth to the baby, we are fearing that we have transmission, mother to baby. Once you start contact, you use a spoon and the baby is given, or you kiss the baby and they pick up the bacteria. Then now you are there. You've introduced the bacteria to your child.
Wow.
Yes.
Okay. Yes. Whoa. I don't think we ever look at things like that. I think when you're a mother, you always assume you're good for your baby, so you can, taste the baby's food, you just feed them.
Now that is how, in fact, what some research has shown, if you look at the mother's dental hygiene, you can be able to predict what the child will be like.
Oh,
if the
really?
mother has open cavities that are not taken care of, half of the time, the child will have what we call early childhood caries, or what we call nursing bottle caries. Because you see, when you test the food and give the child, you won't test the food, find out if the food is cold enough, and then go wash the spoon again and start feeding the child. You'll do it directly. And that just loads it up.
Yeah.
Yes.
There's something you're saying, nursing
bottle caries.
Nursing bottle caries. What is that?
When you see, when you feed the child with the bottle, the bottle we use is not like the mother's physiological nipple.
Yes.
So in the bottle, most of the time, the bottles have a very big hole, which just lets everything come in the mouth.
Yes.
Now, when you give the child the bottle, the milk pools in the mouth.
Yes.
Whatever you're feeding, especially if it has sugar, it pools in the mouth.
Yeah.
And the moment it pools in the mouth, then you start having decay. And that decay is usually very characteristic. You'll see it on all teeth except the lower front teeth.
Wow.
So you'll see a child will walk into the clinic and all the teeth are decayed except the lower front teeth. The lower front teeth don't decay because the tongue protects them. It's on them. But now, with that nursing bottle caries, is a form of early childhood caries which is really eating up children, especially with mothers who go to work and you leave the house help with just the bottle, then it brings up a problem.
Okay.
Yes.
And when you say that this can happen early, how early is early? Like, how early, how old is this baby? What age are they that they can be affected by this bottle dental?
When you see the first tooth, it's nursing bottle, just the nursing bottle.
Yes. Okay.
Now, you see, the first tooth comes in the mouth roughly 5 months, 6 months, isn't it? So we are saying that the moment that tooth comes in the mouth, it's already at risk.
Okay.
So as the other teeth come in, the baby teeth, they're usually 20 in number. The last baby tooth comes in between 24 and 36 months.
Okay.
So all these teeth, and you see when the tooth comes in the mouth, it is not very hard.
Yes.
It gains its hardness once it's in the mouth. Now the tooth is slightly soft, so it is vulnerable. Just like a baby is born vulnerable, the tooth comes in the mouth and the tooth is vulnerable. And then you introduce the bacteria from the mother, then you give it milk and everything. So you've given it the food the bacteria need and the tooth surface, and therefore when the bacteria feeds, it produces acid from the food. And then the acid literally breaks down the tooth. And you see how brushing helps. When the teeth are cleaned or brushed, you interfere with that cycle. So it means every time you feed your child, the moment you finish feeding, even when they don't have teeth, when they have that gum pad, just the gum, you need to have a cotton, just the normal cotton, dip it in warm salty water, and just wipe them every time.
Okay.
Yes.
All right. And just because you're talking about the gum, and because I was wondering if, the nursing bottle cavities, I'll call them cavities, right?
Yes, that's okay.
Nursing bottle cavities, it wouldn't affect the gums?
No, you see, for the cavities, they only form in mineralized tissue, which is the tooth. So at that time, what happens is if you're not cleaning and everything is in the mouth, the bacteria is alive, you understand? Because it has food. So the mouth, that's bacteria that is in the mouth, but once it gets the food and breaks it down to acid, then it becomes harmful.
Okay.
So it has food. So the moment the gum pad is there, if you're not cleaning the gum pad, the bacteria is there, the food is there, the acid is breaking down. Then the moment the tooth checks in, it's checking in into the acid, and that's how it's broken down.
Okay. And you just talked about cleaning the gum pad with like cotton wool and some warm water. How early can you start? At what age can you start the cleaning? As soon as you start breastfeeding? Yes,
as early as you start breastfeeding. You see what we want, and that's why when you ask oral hygiene, I told you it is a practice. It is something you need to start. If I tell a mother to wait for the first tooth, number one, some mothers will never notice that first tooth.
True.
Yes, some mothers will never notice it. In some children, most children, it's the lower two teeth that come out first, isn't it? Other children, is the upper teeth. Now the risk with the upper teeth coming in first is you won't notice. Then when
because
you don't
of the
notice,
lip.
yes, because of the lip, and that becomes a problem. So that is why we insist that immediately you start breastfeeding, you start doing the cleaning. Even up to when the first tooth comes in, because you can't brush it, you still clean with the cotton.
With the cotton.
You just put the cotton after breastfeeding the child immediately. You put the cotton in warm salty water and you wipe and dispose. And even if you have a help at home, you train them. They just need to wash their hands. Once their hands are clean, after they have cleaned the baby, then they do it, and it becomes routine. Once it becomes routine, when the permanent teeth, when the milk teeth come into the mouth, they are coming into a clean mouth, and the habit is being picked up, and therefore even when your child is able to talk and move around, you won't have a problem, because most mothers will, but my child doesn't want to brush, they are not comfortable. It's because this is something you're just starting now.
Yes,
the child
you've not inculcated it from
the child
an early
won't
age.
be cooperative in that.
What about the tongue? Because I know it's also a very important organ in our mouth that carries a lot of bacteria. And I know even when kids are young, you notice a lot of the milk you notice the white color on their tongues. So do you also clean that with a cotton wool?
The white color on the child's tongue is quite normal. That we expect. As you clean with the cotton wool, most of the time for the child, the tongue is a bit small and everything, and they have saliva, so we don't really concentrate on it, but you can pass a swipe on it. But that white color is not so abnormal in children. Sometimes the child's tongue will be white. However, if it's totally white, then there's a problem. You need to visit a dentist to have it looked at. However, just some whitening of the tongue early is quite normal, because you see now there is a slight imbalance. The mouth is now being, bacteria is coming in, colonizing. Our mouth has bacteria, which is normal. We just need to keep them balanced. So early in life, they are just coming in and colonizing. So it's fine, it's quite fine, but not totally white.
White. Okay. So we've been using the cotton wool now with water. When then now do you introduce a toothbrush, or what is the next stage?
The next stage now, we want to introduce a toothbrush roughly at about a year. You have 2-3 teeth. You want to introduce the toothbrush at a year. Now, when you're introducing the toothbrush at a year, you're just doing the normal soft toothbrush. If you go to the chemist, you'll ask for the kids' toothbrush. It is smaller, the bristles are shorter, and it's very soft.
It's soft,
At the start, you're not cleaning with toothpaste. For the first 1 year, even up to 18 months, you're not using toothpaste yet. Then now, we move to the next thing. Now you have a few more teeth in the mouth, and now you are now to start using toothpaste, because a very important component of toothpaste is fluoride. As I had said earlier, when the tooth comes in the mouth, it is not so hard. That fluoride facilitates the hardening of the tooth. If you take a child who's not had fluoride and a child who's had fluoride, and they're all cleaning the same way, the child who's had fluoride, not in excess amount, just in the correct amount, will have no cavities, or will have lesser cavities than the child who has no fluoride. It's because when the tooth comes in the mouth, it needs to mature. It needs to harden. Fluoride helps it in hardening. So now, at about 1.5 years to 2 years, when you now start using toothpaste, we usually prefer, if you don't buy the child's toothpaste, because now the child's toothpaste has about what you call, we quantify the fluoride in a child's toothpaste is about 500 parts per million. That's just a quantitative thing. If you read on the toothpaste, you don't need to know it, but if you go and ask for a child's toothpaste. But in most cases, people will use the adult toothpaste, isn't it? You just do a smear. You see, a smear at 1 to 2 years, 2.5. Once the child reaches 2.5, now you move from the smear to a pea size, just the size of a pea. You put and you let them. Now, because at 2 years, 2.5, now they can spit. So now you're increasing the amount of toothpaste a little, and then by the time the child is 6-7 years, then now you can use just slightly half of the adult, like you see how you smear yours, just half of that for the child. Now the thing we should know is, this is a responsibility of the parents, brushing the child. The child doesn't have the manual dexterity to brush their own teeth. So most children, I will say safely at 7 years, then the parent can stop brushing. However, most of the time, what I usually advise my patients and their parents is the night brushing. When the child reaches 5 years, the parent has to do it. But the morning brushing, you can allow them, the child to do so that you see how they are doing it, and they keep learning, so that as you transit, when you reach a point, you are so sure that the child now is brushing well.
That's true. Just to take you back a little bit, you said when we introduce a toothbrush, we don't immediately start using toothpaste. Why is that?
the child doesn't have the reflex to spit out at that point in time.
Okay.
Now,
so they'll more probably swallow.
They'll swallow fluoride. Now, fluoride is a double-edged sword.
Yes.
In dentistry, fluoride is a whole thing, and now we are advancing, trying to see even if it affects the brain, because fluoride is a double-edged sword. So we want the child not to swallow a lot of fluoride. So that's the simple reason why we don't use toothpaste at the start, because most of the toothpaste are fluoridated. And again, I will really discourage, if a parent tells me, can I use an unfluoridated toothpaste? I will discourage it. Reason being, transiting again from the non-fluoridated to fluoridated will become a problem. So I'll prefer the parent starts with a fluoridated toothpaste, but does not start when the child can't spit out, because you see, you want to spit out the excess fluoride. A very young child, a 1.5-year-old, might not be able to spit out.
Okay. Yes. And what's the difference between the kids toothpaste, the one where they write in the shops, you see 2 to 5 or 0 to whatever? Is it now the quantity of fluoride? The quantity of fluoride,
and even the amount, the additives. You see, for an adult toothpaste, the abrasive is slightly more. The toothpaste also has abrasive in it, isn't it? The abrasive is more. For the child's toothpaste, you have slightly less abrasive and nearly Yes.
All right. So maybe we can just go into, there's a point where you talked about horizontal brushing.
Yes.
And where some people, and I'm sure most of us, it's just this is a horizontal brushing.
Yes.
So how should we brush our teeth? I mean, so that we don't go to the doctor and then you're telling us, you've just been brushing horizontally.
Do I demonstrate, or I can explain it first?
Explain it, then you can
demonstrate. So when you're brushing your teeth, we prefer that you do it in circular motion. This is something that you acquire when you start practicing it. Okay? So you hold the toothbrush. Most of the time you angle the toothbrush towards the teeth. Let me just have this one nicely put.
Okay.
So when you angle the toothbrush towards slanting up and down when you're brushing, but then you do the brushing in circular motion. You don't, the horizontal one I'm talking about. Excuse me, let me just sort this out.
You want to take it out so you can be able to
so that
demonstrate better. So we're learning how to brush our teeth, guys. If you're at home, you've not been practicing brushing your teeth very well.
Yes.
I'm sure you don't have these models that we have here at home, but tonight
now,
you'll be brushing your teeth better.
You see, when you're brushing, you don't, this is the horizontal brushing I'm talking about, this. Now, when you do this, what you're doing is you're just hitting the gum, and that part is delicate, and therefore wearing off the gum and wearing off part of the tooth. As I had mentioned earlier, toothpaste has an abrasive. That abrasive will actually wear off the tooth. Now, when you angulate the toothbrush up and take it round in circular motion, like that, that way, what are you doing? You are actually massaging the gum and at the same time removing any dirt that is there and cleaning the tooth. Okay. For children, now, it's the opposite. For children, we allow them when they're learning to do the straight thing, because for children, they don't have manual dexterity. We are not starting to tell them do it in circles. We are just telling them not using a lot of strength. How you hold a sharp pencil, that's how you're supposed to hold your toothbrush. It means if somebody hits your elbow and you're holding your toothbrush, it should fall off. Now, you don't hold your toothbrush firmly. And even when you're brushing your child, you hold it as gentle as you'll hold a sharp pencil, so that it's very gentle and we are not causing any effect. And then for an adult, when you're brushing, and even a child once they reach 6-7 years, always the last thing you do is stick out the tongue so that you brush the tongue. But I always insist that we start doing it in circular motion. You just move from your horizontal to a circular, so you do it round, and most of the time we want you to brush at least for 2 to 3 minutes in the morning and 2 to 3 minutes in the evening. And you see, that's why I insist on the evening brushing, because now in the morning you are hurrying to beat traffic and everything, so
you're thinking, traffic in Nairobi
and leave. But if in the evening you have time, you can take 2-3 minutes and just brush your teeth nicely, circular motion, brush everywhere, brush your tongue, and then go to sleep.
Yes. All right. Okay, we're going to take a little break, and when we come back, I think hatujamaliza kubrush your meno.
We'll do it now
properly.
Yes.
All right, so we're going to take a little break, guys. If you have any questions, do feel free to reach out to us on our social media handles at Ebru TV Kenya. Let's enjoy the break, and when we come back, we'll continue on with our conversation. Welcome back, guys. I hope you guys have enjoyed that little break. We've been having a conversation around our oral hygiene, how to take care of ourselves when we're pregnant so that our children, our growing babies, don't get affected by our oral hygiene. as well as how to introduce our children to brushing their teeth. And that's what we're talking about right before the break with Benjamin. We're learning so much. I hope you guys at home are learning as well. Do remember to share what you are learning, or if you've got any questions, do reach out to us on Ebru TV Kenya. Let us know what your thoughts are. Are you struggling to, you know, teach your child how to brush their teeth? Do you have a question for Benjamin? Reach out to us, because this is your opportunity, right? So Benjamin, right before the break, we're talking about how to brush the teeth properly. And you're talking about the circular motion. But I wanted to ask you about, you know, even the inner teeth, and because I feel like most discoloration happens even inside. So is there a technique to brush inside?
On the inside now, you just take your brush in the horizontal motion.
Okay.
But the angulation of the brush is what usually makes the difference. If you put the brush directly horizontal at right angles to the tooth, then you don't pick much. You should always put it at an angle about, for mathematicians they say 45 degrees. At about 45 degrees. Okay? And brush. Now, when you notice where you are picking the stains, and you've had your teeth cleaned and everything, always note where you've picked the stains. And every day, if today you start brushing with your left side, tomorrow start with the right side. That really helps, because you see, once you get into one routine of starting with one side, this is what happens. You keep missing the same point and the same points on the tooth, and then those become your weakest link.
All right. So as we talk about even parents and getting their kids into the habit of brushing their teeth, when should a parent, you know, take their child for their first dental visit?
The first dental visit, that usually is either when the child is 1 year old, or 6 months after the first tooth. When you notice the first tooth in the mouth, within 6 months you should see the dentist. Wow. Because there are some children whom the first tooth will come in at 4 months. Okay, so we'll prefer you see the dentist at 10 months. That means 6 months after the first tooth comes. However, in those late growers who maybe at 8 months is when the first tooth is coming, and now you don't wait too late, at least 1 year. So let's just put it at 1 year or 6 months after the first tooth comes in the mouth.
Okay. And why is it important? First, why 6 months after? And then why is it important for us to, you know, take our children to the dentist?
Research has shown that between the time a cavity starts forming and the time when you have physical evidence of it is usually 6 months. At 6 months, I can be able to tell you if you're doing the correct thing in the cleaning or not. If you bring it earlier, I might think you're doing the correct thing, let you off, and then after 2 months, a cavity has formed. Okay. So at 6 months, if there's anything, then I can tell you, now we need to change this so that even the other teeth coming are not affected. Okay. Yes. But there's a second part to your question.
Oh, yes. I mean, second part was why, what did I ask? Just why is it important for me to then take my child to visit the dentist?
Yes, so that now when you take your child to visit the dentist, then the dentist can tell you if there is any problem. Yes. If the teeth are coming in naturally, okay? Yeah. We can pick out so many things.
Even like the shape. So even kids who later on get braces, maybe you can pick it up at this stage?
No, that one we can't pick it up that early, but we can pick it up if you continue with your normal dental visits, which now the dentist will assess. Yeah. If I assess and I think this child is what we call high risk. High risk are those, after on my assessment, I look and I think this child can develop cavities because I've looked at the mother and I'm like, the mother has cavities. And I've asked about the last time anyone visited a dentist, and it's long ago. And I'm asking about the diet, how they eat, and I'm figuring out they are eating a lot of carbohydrates. And I ask about how they clean, and they are not cleaning. I see this child as a high risk, isn't it? So this is a high risk child. I will see them every 3 months. Okay. To just reduce, I want to reduce the risk to minimum, isn't it? For a child that I find they're brushing nicely, the parents are practicing good oral hygiene, their diet doesn't have a lot of carbohydrates, they don't snack so much between meals, then this is a child I consider a low risk. I'll see them every 6 months. Okay. So that's why we're saying the first minimum we've agreed 6 months after the first tooth to 1 year. But after that, the dentist will assess the risk of the child developing dental caries. Okay.
Then
and therefore
administer.
I'd tell you if I'll be seeing the child every 3 months or I'll be seeing your child every 6 months.
6 months. Yes. Oh, okay. Yes. That's interesting. Yes. So I'm just thinking, I mean, these are milk teeth. Zitangoka tu zitoke, and then new ones grow.
That question we answer it daily when somebody comes and they tell you, no, I want it out. They ask you, the child is 4. They tell you, sikuna ingine itamea. When you say yes, they say toa tu. Their teeth have their functions.
Okay.
And we have to accept that all of them have their function, and we need to keep that function. Okay. The first main function is just the normal chewing. When you remove, teeth are in constant equilibrium.
Yes.
When you remove one tooth, the other tooth is as good as useless in the mouth. The opposing tooth, because now how will the child eat with that side?
Yeah.
Now, that is one of the things that happens.
Okay.
We don't remove teeth because we want the child to be able to chew properly.
Yes.
The second thing, and most of us underestimate it, is aesthetics. Those children, they talk to each other in school. When you have a 3-year-old that we've removed the front teeth because they had decay, the child will be psychologically not okay. They will go to school and their friends will laugh at them and tell them you're mapengo and such things. And they'll come at home and you realize the child doesn't like going to school. It's more of a psychological problem.
Yeah.
Okay. So that is mainly, it goes in the aesthetic zone.
Okay.
These children are learning to talk. There are some sounds that are said with some teeth in the mouth. You remove, you remove the front teeth early, the child will not be able to pronounce some things for a very long time till they wait for the permanent teeth to come in the mouth.
Okay.
And the final and the most expensive one that I always tell parents, this one you'll pay for it, is when you remove a tooth early and then the space closes. If we are to look at this model, you'll see this is a permanent tooth below a milk tooth.
Okay.
Okay.
Right at the bottom there.
Yes, you remove the milk tooth. You can see there's another tooth down there. So when you remove the milk tooth, the permanent tooth is there. It's supposed to be guided and come there, isn't it? You've removed the milk tooth. This tooth will move there. Close that space. And then the teeth will not be arranged nicely. Now, once the space closes, we usually say the milk teeth are the best space maintainers, isn't it? You've not maintained that space.
Okay.
Okay. Now, when you don't maintain that space, the other teeth come, and then you have a badly aligned teeth. And then at 12, 13, you go to the orthodontist now, and the orthodontist tells you it's braces, and in Kenya, braces are very, not in Kenya, I think world over, braces are very expensive.
Okay.
They take a long time. And actually, when your children start losing school time, between class 7, because that's when fixed braces are done most of the time, to form 2, form 3, that is a good chunk of time wasted, okay? Plus, teeth help the bone to form. So when you remove the tooth early, the bone around there just collapses. And then the bone doesn't form, the jaws don't grow, and you'll still end up with the same problems of crowding of the teeth, and therefore eventually needing braces, which means a simple tooth that will have been kept in the mouth has led you to a very long sequelae of events that eventually you're paying so much for a small thing that will have been earlier.
Prevented earlier. And I'm just thinking, the milk teeth are kind of attached to the permanent tooth.
Yes, the permanent tooth is mostly below the milk tooth.
And the milk teeth usually naturally drop off. Like you wait for them to shake, then they drop off. But is there a chance that if the milk teeth then gets decayed, would it then affect the tooth that's at the bottom?
Yes, it does. It affects. And that's another reason why we want to keep it in the mouth, but keep it in a state that it is not continuing to decay. Because that decay goes to the permanent tooth. And then now the permanent tooth won't mineralize as well. So when it comes in the mouth, it's not as well mineralized, and it even sometimes it interferes with the shape of the permanent tooth. Yes.
All right. So now teething. Let's talk about teething. So the first tooth has formed, and the child is not sleeping, crying. Mother is frustrated because of the discomfort that is happening on the gums. What are some of the natural remedies that mothers can use to soothe their children when their teeth are coming up?
The main thing about teething is the irritation of the child. What irritates the child? You see, when the tooth breaks into the gum, there is inflammation. Now, inflammation that includes, now the signs of inflammation is the gum being red, being swollen, they can't bite or anything, so they become generally irritable. And you find the children biting on things. Isn't it? And when they're biting on things, then this ends up now bringing the diarrhea, because you see, when they're biting on things, they're not biting on clean things. They're biting on very dirty things. This ends up leading to things like diarrhea, then dehydration, and it becomes a long sequelae. And traditionally, that's when you'll find children going and having some teeth removed when they're not supposed to be removed. Mostly the best remedy is just what we call like a painkiller, but a localized painkiller. So we call it analgesia. It is gel. If you go and ask for the teething gel in the chemist, you'll get it. You just take it, put it on a cotton bud, and just apply around that area.
All right.
The other thing are called teething rings. Now, teething rings are usually what you give the child. They are clean, so the child can play with them and put them in the mouth. So that sorts out the irritation.
Okay.
However, during teething, the main remedy is we want to bring down any other infection, isn't it? We don't want the child throwing things in their mouth. So we are sorting out the pain by having something just applied there for pain. It's local. You're not giving them a painkiller per se. You're just applying around there, isn't it? Then you have the things they are holding and biting onto. You are trying and ensuring that they are clean things. Okay. Then you don't want them biting on dirty things, because then that even worsens the inflammation, because you see the area is inflamed, and then you want more dirt is coming there. Now, the moment you're having more dirt there, you're even worsening the inflammation. Yes. Okay. So mainly just let's deal with the pain. Keep the place clean. So normal cleaning, cotton, how we've said, warm salty water, wiping there after you've put your painkiller around there. So the child is comfortable, you are cleaning the place. So we are not letting anything new come, and they are having clean things to play around
to chew around. Okay.
And the teething rings come in very handy.
Okay. All right. So I hope that will help you back at home as you deal with your child's teething journey. I'm just curious to know about flossing your teeth. Do you recommend this for children as well?
Children, the contacts are not so tight, so we think that the flossing should be when the back teeth come, because generally children's teeth are spaced. Even at the front, they are spaced. Flossing is the cleaning you do between the teeth. Okay. Now, when the child is flossing, they don't have, again, manual dexterity. It is you, the parent, who is supposed to floss. And you'll just floss between, mainly it's the back molar teeth, the big teeth, that will have tight contacts. And most of the time it's just one tight contact on the lower side on each side, and the upper, there are two tight contacts. So you just have the floss on your finger and run it between the teeth. So children will rarely know how to floss themselves until they are 8-9 years. Okay. So for a start, if you feel the contacts are tight, and that's why I'm saying again, when you visit the dentist will even tell you, this one, the contacts are a bit tight, we have to floss. The other one, just normal brushing will suffice. And therefore, you have to floss between starting 3.5 years, going all the way up to the time we move to permanent teeth. And as you floss, sometimes allow them, there are flosses that come with handles, allow them to also learn the flossing. Sometimes you underestimate them. They may just be able to learn it. But it is an acquired thing which takes a lot of time to get for children. As they develop, they'll acquire it. Okay. So, and is it recommended to floss your teeth? Because I think I've read somewhere that flossing can also damage your gums, or... What are you using to floss? So it's what you're using. If you're just using the normal dental floss, it should not damage your gum. Okay. You're just putting it between the teeth and taking it up, down. So you're just removing any food that is in between the gum. However, the problem is this, we have the floss that is on the handle. So somebody flosses with that side, feels it's not adequate, then turns the handle and uses it in the gum, like a toothpick. Now, toothpicks are actually a risk. So anything that you poke into the gum is a risk. But just a normal dental floss should not hurt the gum. If done gently, doesn't hurt the gum. So toothpicks are more dangerous. Toothpicks is one of the things that we use it. It's a necessary evil, but it's a blind thing that even if a part of it broke inside the gum and stayed there, you will never know until you come with a swelling and the dentist looks for everything. It's not there, then realizes it's something that broke in the gum. So flossing doesn't really hurt the gum. Okay. Yes. All right. Let's talk a little bit about bad breath. Like, I feel like sometimes you can brush your teeth but they still, bad breath going on. What could be causing this? Most of the time, the bad breath, we usually say you have to know the origin of the bad breath. If you go to the dentist and they check, they will ensure that you don't have tartar in your mouth. Even those cavities, when food gets there, you see food just lodges into the cavity and starts rotting. Exactly. So that will contribute to the bad breath. Okay. By the time you notice that, you'll be struggling to brush, but you have cavities in which food gets stuck. That is a big problem. Okay. But then the other problem might come from the tonsils, the adenoids down back inside, and that's when we refer you to an ear, nose and throat surgeon to check if it might be the cause. But the main cause of bad breath in the mouth is the gum and cavities, which with cleaning, professional cleaning being done, and what we call cleaning and polishing being done, and you brushing nicely, then that should be eliminated. That will eliminate bad breath. But if the bad breath, even after cleaning, persists, then we go look for another course.
Okay.
You might send it to an ENT to
Yeah.
have a test. But again, sometimes people have reflux, gas reflux, might cause
That's
bad
true.
breath. So once the ENT looks and says, no, me, I can't see anything, then we might need to do further tests and see. However, the most common basic thing about bad breath is inside the mouth. And sometimes people just feel they have bad breath when they don't.
Yeah.
That is what happens to a very big proportion.
Yeah.
When you're talking to someone and they look aside, you feel it is bad breath most
Maybe
of the
it's
time.
my breath.
Yeah, maybe it's your breath. That's just what we call pseudohalitosis. It's false bad breath. But cleaning, good cleaning, should be able to sort out bad breath. Just good cleaning, professional cleaning at the dentist, and you brushing nicely. Any bad breath is sorted. If it's coming from the tonsils or around that area, adenoids, then the ENT should be able to help us. Now, if it's coming from inside again, as we advance, we will realize we've eliminated everything, and then we tell you now, go see a gastroenterologist and let them give their opinion.
Okay. All right.
In children, it's just pure brushing most of the time, because for children, the tonsils inflame and they go up and down, so they will rarely be a big problem in children.
Yeah.
Bad breath is a very small problem in children. It's rarely there. If they're just brushing nicely, they are going for their dental cleaning nicely, it's really a big problem.
Okay. Let's talk about sweets. When we started the show, I said, will you be those doctors with sweets? But you looked at me like, hi, what are you talking about?
Yes.
I felt like you had a speech ready about it. I mean, in regards to sweets.
Now, this is what happens.
Yeah.
This is what happens. I'll just break it down simply for the people at home in a simple way.
Yes. Please
Anything that sticks on the teeth is not good for the teeth. Anything that sticks.
Okay.
When I'm biting into something, do you realize, have you ever seen a fruit that sticks on your teeth?
No, maybe pineapples and mangoes. Kwanza those small mangoes.
Yes, it's the thread
go
of the mangoes. Yes, those ones you clean out.
But they don't
it?
stick
They don't
on
stick
the teeth.
on your teeth, isn't it? Anything that sticks on your teeth is not good.
Okay.
It's not good. Sweets are at they're usually what I say the main problem, because even when you take your child to the pediatrician, the pediatrician gives them sweets. Then when they come to the pediatric dentist, and then they tell you, am I going to get sweets today? And mommy says, no, this is the dentist, you can't get sweets here.
Yeah.
Those are not good. Sweets, cookies, biscuits, all those things are not good. Why? Because they are sticky.
Okay.
They are sticky. We've agreed carbohydrates is what bacteria in the mouth feed on.
Okay.
All those things are sticky. Bacteria will feed, and they'll have enough time now to produce the acid and have it being problematic, okay? Now, these sweets, we can't ban children from eating them.
That's true.
Good.
That's the reality.
That's the truth, isn't it? What I usually tell my children is, I want the eating frequency reduced. Because for these carbohydrates, it is not the amount. You see, if a child ate, even queen cakes are a big problem. Cakes are a big problem. The sugar things, isn't it? If a child ate a cake at breakfast, I'll be very happy. Than if you gave the same child the same cake at 10 a.m.
Why?
Because at breakfast, I've just told you, you brush after eating. So I'll be so happy if the child put the cake at breakfast, or in the evening, after in the evening at the 4 o'clock tea, they have the 4 o'clock tea.
Because then they'll brush before they sleep.
And then they'll be active, brush before they sleep, and that I'll be okay with it. But then when the child is snacking on it at 10 a.m., you can imagine the next brushing is at night. All those particles will be on those teeth, having bacteria working all that time.
Yeah.
Yes. These days we have sugarless gum, which we advocate for. It has what we call xylitol, which then can't be broken down by the bacteria into acid. So we have sugarless gum, but sweets, biscuits, all those confectionaries, not so good. Not so good for the teeth. And you see, the moment the child is introduced to that, withdrawing it's very hard.
Yeah,
so as a mother, you just need to make sure that it is even not introduced, so that when they have it, it's once, occasionally, not totally out, but once, if there's a birthday party and the children are at a birthday party, they can have it.
In fact, that's why they discover these things, and you're just like, you've been hiding these things from me, mom, all my life.
But you have to explain to them
why
that this is what will cause your teeth to have holes, and it will be a long walk.
Okay.
Okay.
Yeah, so someone at home is watching and thinking, so I stop eating my maize and my sugar cane and
no, that is natural. Those ones don't have. You realize maize doesn't really stick on your teeth. Yes.
Okay.
Yes.
So those are fine.
Those are
in fact, do they strengthen the teeth as we think? Because I feel like I mean I have this mentality that sugar cane, because it's hard and you're breaking it, it's going to strengthen my teeth.
What it does, You know, like if you look at other mammals, they rarely have their teeth crowded. When you give your children soft diet, the muscles are not stimulated, and therefore the jaw growth is not maximized.
Yeah.
What you are saying with sugar cane and those things is that that diet just helps you with jaw growth, because as you use the muscles, the jaw grows.
Okay.
And when the jaw grows, some of these things are sorted out.
Yeah.
Yes, because somebody who does not eat at all, then I don't think their jaw will grow.
Yeah.
Yes.
Indeed. I mean, someone at home is probably wondering, what? My jaw needs to grow. But, I mean, I feel like I can speak to that because we learnt about it when my sister had an ingrown tooth.
Yes.
And that's when the doctor was like, yeah, there's no space for your tooth to grow because your jaw hasn't grown. You're like, wait, what? I thought that's a natural thing that should happen.
It's natural, but you see, when we say nature, there is, these days, we are trying, if possible, these guys can even manufacture food that we shall just be given and you drink.
Yeah.
And you're okay. What you see, the chewing movement.
Yes.
And even that's why we go back to the child having all the teeth. Because it's when the child doesn't have all the teeth functional, they start avoiding even eating. The children will be brief at eating.
Yes.
And gone. Because now the muscles are not stimulated. Now the muscles are attached on the bone. And there was the expand and contract. As they contract, they pull the bone, and the bone forms and the jaw grows.
Okay.
Yes.
All right.
So that diet, the very soft diet, doesn't stimulate jaw growth. The slightly hardy foods will help the child with the jaw growth.
Okay.
Yes.
I think just to take us back to maybe the pregnant mom and remedies that we naturally start to use thinking we're helping our teeth, I just want to ask you about them. So, for example, maybe for bad breath, pregnant mom may be used to using mouthwash. Is that okay for her?
Now, it depends on which type of mouthwash. There's mouthwash. The mouthwash that contains antibacterials and such things that you can't use for a very long time. You're just supposed to use it for a short time. But then there is the other normal mouthwash that doesn't contain antibacterial that people tend to use for a longer time. It just helps you with controlling the plaque. But you see, what happens is, if you are not cleaning nicely, mainly what happens is, if cleaning is more of a mechanical thing, even the toothpaste is just an addition. Somebody who doesn't use toothpaste, we even tell you use ash, use salt. The toothpaste is just an addition. Cleaning is more for you're mechanically removing the dirt from the tooth and then rinsing and spitting the dirt out, and that is it. So for mouthwash, you have to brush, you have to go for the professional cleaning, and then mouthwash will be used as an adjunct, as an addition too, because mouthwash sometimes contains antibacterial, which kills the bacteria in the mouth. But you see, if you use an antibacterial for a long time, the bacteria starts mutating. And if you use a mouthwash for a year, by the time you're reaching your second year, the bacteria in your mouth has known a way of getting around it. So, so that just goes like the way we have bacterial resistance, even in TB, when you don't take your meds and take them sometimes, that happens. Yes. So the mouthwash is not a long-term remedy. Cleaning is a long-term remedy. You brushing your teeth is better than you just using a mouthwash and going to sleep. Yes.
Okay. So I think then another short-term remedy that people, I think you've talked about it, I think nowadays when we go on YouTube, you watch all these ideas that we get, and you're just like, hey, maybe I can whiten my teeth with that charcoal.
Yeah.
Sorry guys, we had a little technical difficulty right there, but we gave you our Kids Corner, where we love to see our kids laughing at the simplest of things that we take for granted, but there they are laughing out loud at the simplest of, life's pleasures. So we're going to continue on with our conversation, Benjamin. Sorry for that. We got cut off a little bit there, but maybe I can just tie back into our conversation and just go back to the permanent teeth. What happens if a child, they're playing all these games, they go to school and they fall and knock out one or two teeth? What happens
That happens. Even today morning, one of the people called me and told me the child knocked out a tooth in school.
Ouch.
Now, this is education that actually we need to start targeting the parents, because they are simple things. That tooth, number one, if it's a milk tooth that has come out, just go see the dentist. 90% to 100% of the time, we don't return milk teeth.
Okay.
Because then there is no need. It's an exercise in futility.
Yes. Okay.
The first 6 hours are very important for us if a tooth comes out.
Okay.
How it's handled.
The first 6 hours. All right.
When the tooth falls, no one should panic. The tooth has come out, a child has fallen, the tooth has come out, it's a permanent tooth.
Yes.
Don't panic, look for the tooth.
Yeah.
Figure out where it is.
Okay.
You find the tooth, pick it up. Don't pick it up with the root, pick out the crown, the white bit. Pick it out with the crown, isn't it? Look at it. If you feel it's dirty, just go in normal tap running water.
Okay.
Just open the tap and let the water run on it for about 10-15 seconds.
All right.
Then try return the tooth in its socket.
Really?
And then have the child bite on a handkerchief as you go see the dentist.
What?
Yes.
Wow, okay.
However, if you're trying to return the tooth and you notice the tooth can't be put back
because
in the
sometimes
socket,
it cracks and part of it is still inside.
Yes. Now, if you no, once part of it is inside, don't try returning.
Okay.
I was assuming the whole tooth.
The whole tooth
once the whole tooth is out, isn't
okay.
it? Now, if the tooth is, as I was saying, if the tooth has, you can't push it back in.
Yes.
Just take it, okay? Put it in a container. Number one, put it in a container with cold milk.
Yeah.
Just cold milk.
Cold milk.
Cold milk, put it in that container. I prefer plastic containers. The other containers tend to pick up the heat from your palm and then the milk becomes warm and by the time you reach the milk is warm.
Yeah, yeah.
Put it in cold milk.
Okay.
Plastic container most likely, isn't
Alright.
it? Another option is, if you don't have milk, have the child, although this might make the child panic, if the child is a big child, an 8-year-old, 9-year-old, you can put it in their cheek.
The milk.
The
tooth.
In their cheek. However,
Yes.
if you feel the thing has traumatized them, they might swallow it. Don't try. Now just have them spit in a container their saliva, and once they have spat, because you see after being hit, there's a lot of saliva produced.
Yeah.
Tell them not to panic. They'll see some blood, but let them spit in a container
Even
in
if
which
it
you've
has
put the
blood.
tooth. Yes, then put the tooth in that container and bring it to the dentist. If this tooth arrives to the dentist within 6 hours and it's been kept either in milk or in the child's cheek or in a container in which the child spat the saliva in, 90% of the time you'll return the tooth nicely, do what we call splinting, attach it on the other teeth, it will pick up. Okay.
Wow.
The 10% that there is failure, it doesn't fail immediately, it will get ankylosed, then eventually maybe in 7-8 years it will fall off and then you can do a replacement. Okay, so don't put it in salty water.
Okay.
We don't like salty water.
Yeah.
We don't want the tooth to be in a hot environment.
Okay.
However, if you realize like the tooth, your child fell in school on Friday, the school called you, you went to school on Saturday, that's late. However, still come with the tooth to the dentist. The dentist will return it, but now that tooth will be there. It will be there to keep the space. Eventually, it will fall off and you'll have to do a replacement.
Okay.
But at least for the 4-5 years, when the tooth is there, as I said, the bone is molding nicely, and therefore when you move now to replacing that tooth, you will have helped the child to at least keep the tooth for some time.
Wow.
Yes.
Okay. Yeah.
So that is just the best way that the parents should know that if it's put in cold milk in a container, if it's put in saliva, if the child didn't get so hurt but the tooth came out, sometimes things just yank out their teeth. If the child is okay, they are not unconscious or anything, if they put it in their cheek, it's okay. However, if you can pick the tooth, wash it, return it, and let the child bite on a handkerchief as you go to see the dentist, it will have sorted out the issue.
Oh, wow.
Yes.
This is information I honestly have never had in my life, and that's why the shock. I don't know about you guys back at home, but I honestly didn't think that that was the solution that you're going to give me. Right
we
back.
return most of the teeth.
So these are things we can actually, if when informed, we can take care we can take care of it at home. So we have a lady who called in, Phyllis from Nakuru, who is asking, what causes tonsils? Is it anything to do with oral hygiene?
There are children who have recurrent tonsillitis. It is not entirely from the oral hygiene, but the oral hygiene plays a big part.
Okay.
You see, as I told you, the mouth has bacteria.
Yes. If
you're not cleaning them, there is an imbalance to the bacteria being more, then it goes. Because most of the children who come and they tell you they're having a bad toothache, half of the time they will have tonsillitis. Once you sort out the toothache, the tonsillitis becomes better.
All right. And what if there's no toothache? Is there any home remedies that...
Now, that is a specialty for the ENT. We won't want to start prescribing remedies, because for tonsils, once we can't figure out what's the causes, if it's not from the mouth, we prefer having the ENT look at them and see if there's a problem.
Okay.
Yes.
All right. Okay. So we had another caller calling in, our directors back there, and they're asking, just a question I asked you as well, what does charcoal help with? How does it help the teeth?
This charcoal is what, you see, mostly people think their teeth are not so white. They'll even go to the back streets and have their teeth whitened, but then they'll come with sensitivity and everything. The abrasive, you see, like toothpaste has an abrasive, but it is it is, how can I say, it is measured in a good amount that
Yes.
doesn't wear off the tooth. However, you realize if you brush horizontally with the same toothpaste, it will wear off the tooth.
Okay.
That's exactly what charcoal does.
All right.
It abrades the tooth. So you see, when you remove the tooth, you'll think the inner part is white.
Yes.
The only problem is sensitivity sets in. Because most of the time, if you go to the dentist and they remove any part of the tooth, they put a filling and protect the tooth. Because as you go inside the tooth, sensitivity becomes more. So you don't want to remove part of the tooth and leave it open.
All right.
So it does what we call abrasion, just like eroding something.
Yeah,
Yes.
so it's not recommended because after some time it will cause that
You'll start having sensitivity.
Oh, wow.
Yes, most of the people who have brown teeth and then they go and they are whitened without doing anything to protect the tooth, the sensitivity becomes a lot.
Okay.
Yes.
I guess it ties into our the way our society is today, that instant gratification. So we look for the quickest methods to, you know, help our problems.
Yes.
But guys at home, we can't escape it. We have to visit our dentist. So I hope you guys have learned so much on the show. I don't know, Benjamin, if you have any parting shot, any words of wisdom that you want to leave our viewers with.
What I always tell the parents is your child's teeth are meant to be there for the rest of their life.
Okay.
But this starts with how we keep the milk teeth.
Yes.
If the milk teeth start decaying, the permanent teeth will come into a mouth that has decay. They will just pick up.
Yeah.
So the moment you don't take care of the milk teeth, half of the time, the permanent teeth will not be.
Okay.
Okay. So we just have to start taking care of the milk teeth, and it will transit into an excellent maintenance of the permanent teeth.
Yes. Okay. All right. Thank you so much. I've learned
so
much. I'm going home with milk and saliva in case of anything happening. Hope you guys are going home with something as well. Do remember to continue the conversation on our social media handles. That's Ebru TV Kenya. Do let us know what your thoughts are. If you do have any further questions, don't feel shy. Reach out to us. And remember to tune in once again next week, same time, same place. Good night and God bless.